Good morning. Thank you for joining me on this lecture. Um, my name is Yves Isingizwe. I'm doing level 3 laboratory sciences at Ines Ruhengeri. I'm going to present a few terms in applied immunology so that you can understand those terms. Thank you. Now let's start our session. My name is Yves Isingizwe. I'm doing level 3 biomedical laboratory science at Ines Ruhengeri. I'm going to talk about on different terms that we found in immunology, especially applied immunology. Let's What are immune checkpoints? Immune checkpoints are those things that help immune system not to destroy own its own immune organ or immune tissues. Here we have definition. Immune checkpoints are regulatory pathway in the immune system that maintain self-tolerance and modulate the duration and intensity. It has two kinds: to maintain self-tolerance and modulate the duration and intensity of immune response to minimize damage to healthy tissues. They are primarily inhibitory signals provided by molecules such as PD-1 or programmed DEF1, PD-Li, programmed DEF ligands, and CTLA-4, cytotoxic T lymphocytes associated with protein 4. This also is a definition. This you have seen this. The primary inventory. This. Why are they important? These checkpoints, it helps our immune system not to react to our own tissue. First, they prevent autoimmune disease by ensuring the immune system does not overreact to normal tissues. Cancer cells can exploit this checkpoint to avoid being destroyed by the immune system, which is why they are targeted in cancer immunotherapy. How do cytokines regulate immune responses? Cytokines are small signaling proteins secreted by immune and other cells that regulate immunity, inflammation, and hematopoiesis. They act as messenger, modulate the behavior of immune cells. Then, key function of cytokines. Have pro-inflammatory cytokines which enhance the immune response to fight infectious or tumor. Anti-inflammatory cytokines, which place or minimize excess immune response to prevent tissue damage. These anti-inflammatory cytokines, it, uh, it is somehow related to the checkpoints to reduce how the immune response is going. Like when the intensity is too much, as I've seen in a checkpoint, the modulation of intensity and duration of immune response. Chemokines guide the migration of immune cells to site of infection or injury. However, growth factors promote cell differentiation and proliferation, stimulation T cells development. Cytokines ensure a coordinated response, balancing activation and splice to maintain immune homeostasis. Then, how do monoclonal antibodies work in immunotherapy? Monoclonal as one of applied immunology in currently medicine. Nowadays, medicine, we use monoclonal antibodies in different diagnosis of disease. Monoclonal antibodies are laboratory produced molecules designed to bind to specific antigen. Immunotherapy, they work by targeting cancer cells. Monoclonal antibodies can bind to specific marker on cancer cells, leading to their destruction mechanism, blocking growth signals of cancer cells, marking cells for immune destruction, and delivering toxins or radiation to target cells. Then immune modulation, targeting cancer cells, immune modulation. Some monoclonal antibodies enhance immune response by targeting immune checkpoints. Neutralize harmful molecules in autoimmune disease. Monoclonal antibodies can block cytokines and receptors, causing inflammation. Example of it is rituximab, embrozumab, and then we have principle behind checkpoints inhibitor therapy. We have seen that checkpoints is there to regulate how the immune response reacts to the foreign antigen, but not overreact to own tissue. So here the principles. Checkpoints inhibitor therapy target immune checkpoints molecule to unblock the immune system, allowing it to recognize and attack cancer cells. Then, cancer cells exploit immune checkpoint to evade immune surveillance. After cancer cells is hiding, the blocking these checkpoints restore the immune system ability to detect and destroy cancer cells. Here it means that after that cancer cells block checkpoints, Then immune system ability are not able to detect and destroy cancer cells. Here, checkpoints inhibitor like nivolumab and ipilimumab have revolutionized cancer treatment by enhancing T cell activity against tumor. Have what are these risks of CAR T cells therapy? CAR-T, which means chimeric antigenic receptors T cells. Our therapy involves engineering patient T cells to recognize and kill cancer cells. Then what are the risks? Risks are while highly effective, it carries significant risks such as cytokines release syndrome, neurotoxicity, on target of tumor effect, infections, graft versus host disease. Here in a cytokines release syndrome, an excess release of cytokines can cause fever, low blood pressure, and organ damage. Excess release of cytokines can cause fever. Then neurotoxicity symptoms include confusion, seizure, brain swelling. On target, there is some cells can be attacked, targeting to target and expressing the target antigen. Infection, immunosuppression from therapy increase infection risk. So let's see the immunotherapy used to treat autoimmune disease. How it is used. Then immunotherapy for autoimmune disease aim to modulate immune system to reduce self-reactivity without compromising overall immunity. Then approach how it is performed. Monoclonal antibodies are prepared. Target and neutralizing cytokines or immune cells driving inflammation. Checkpoint modulation. Blocking immune checkpoint like can calibrate immune response in certain contexts. Heterogenic therapies encourage immune tolerance using modified antigen or T cell modulation. B cell depletion. Drug like rituximab reduce activity of autoantibodies producing B cells. Those are four approaches that immunotherapy is used to treat immunotherapy. There is monoclonal antibodies, checkpoints, modulation, tolerogenic therapy, and B-cell depletion. Thank you. This is end of our session. Thank you for You are attentive. Thank you.